The Morning Majlis, talking the stories that are shaping headlines. This is Pulse 95.
This is Pulse 95 and a very warm welcome back onto the program. We are celebrating the official inauguration of the Aster Hospital in the Boudaniq area or Qasimiya neighborhood of Sharjah, which was officially inaugurated by His Highness Sheikh Sultan bin Ahmed Al Qasimi, who is the Deputy Ruler of Sharjah and Chairman of the Sharjah Media Council. Exciting times for the neighborhood. It's been open for about 2 months as a soft opening, but to talk to us about the official inauguration and how things have been going, we're very kindly joined by Dr. Sherbaz Bichu, who is the CEO of Aster Hospitals. A very good morning and thank you for joining us.
Thank you so much, and thank you for having me with you.
Well, great to hear from you. Now, I think my first question to you should be about how was the official inauguration yesterday, and what were the thoughts of the attendees? And you also had your chairman there yesterday. Talk to us about how the event went yesterday, the official inauguration.
We are humbled and honored to have His Excellency along with us for this landmark event of ours, having a hospital in Sharjah. It's something not less than a dream come true for Aster to have a hospital there. If you look at Aster's operations, we have clinics everywhere spread across Dubai and Northern Emirates. And one of the things which was lagging in Sharjah region was the hospital. So we operate in a hub and spoke model wherein we have clinics everywhere, and when the patient needs an inpatient care, for example, a pregnant lady going into a clinic for 9 months, and when the delivery comes, they go to the hospital. So one of the difficulties what we had in Sharjah was the patient has to travel all the way from Sharjah to Dubai. And you know at times what happens when the traffic is very, very tight. So this is a real blessing for us and for our patients, for having a central location in Sharjah so that our patients will be very comfortable. Care will be just at their doorstep.
Which brings me to the next question. What services or laboratories are on offer at this hospital which will make this stand out more?
So if you really look at Aster, initially we came in to Dubai as a one-man clinic. Our chairman, Dr. Azad Mupini, started a clinic 37 years ago. It was just one clinic, and then we rose, and then we just came into a primary and secondary care. But we now are trending on a tertiary care. When I say tertiary care, it's about complex advanced laparoscopic surgeries, oncosurgeries, chemotherapy, etc. So in Sharjah as such, initially to start with, we'll have all the basic specialty. And then later on, with the expertise what we have in Dubai, we'll start tertiary and quaternary within no time. So, but then our acute focus in the initial stage will be on acute care. When I say acute care, it is about emergency room and in ICU, because these are things which are very time bound, right? The time is, for example, in stroke, we call it as time is brain cell. If you delay, the more brain cells get damaged. So our entire focus in the initial phase will be on ER. We have very well equipped ER and ICU, and it's manned 24/7 by expert doctors, who most of them come from our tertiary centers back in India. In India, our footprints are loud and clear. We have 500,000 bedded hospitals. So these expert doctors who are there, they're there with us right now in Sharjah. So that will be our initial focus. And soon our doctors, based on cases from Dubai, will join Sharjah, and then we'll take it forward from there.
Yeah, I've got to talk to you about the location, because we discussed this earlier, how certain areas are very densely populated, so you need more hospital beds per citizen or resident. The location of Boudaniq in particular, what was the strategy behind choosing it and placing the hospital in this neighborhood?
So if you look at Aster's strategy, when you look at Aster as a brand, we are a hospital which covers all the type of insurance, from lowermost insurance to the higher end insurance. So if you look at that area, it's an area where a lot of family crowd is there, especially since our focus being on maternity and general surgery. I think that made us decide that location. Plus, what we right now we get in Dubai and other places is because of our 3,000 strong doctors. So what differentiates us from others are, across GCC and India, we have around 3,000 doctors. So when there is a complication or a complicated cases, these doctors break into groups and then start discussing, share their experience, and give best to the patients. So what we do is we put patient and patient care in the center of all what we do, so that the patients get the best. So the reason for location selection is mainly because of the family crowd which is living there.
Right. So this is great news. So now, talk to us about that the opening so far. It's been 2 months that you had a soft opening, and what are your overall expectations from the opening of this hospital?
So for every hospital, what we do is see the hospital is we're playing with life. We can't just open like a store and then start doing it.
Yeah.
So there are a lot of backgrounds required. We need to know the processes. We need to induct these doctors and staff into the system. So this 2 months was our trial period, right? And we did get patients. So, but then what happens is when people should be really ready when the real surge of patients comes in. So it was our forming phase. So that means any patient comes in the initial phase, right? The entire crowd is looking at it. Entire nursing team is looking at it. Now our processes are completely streamlined. One of the advantage what we have is most of the team who is working there are led by people who were working with us in Dubai.
Right.
So things are much more easier.
Well, this should be exciting indeed. But just a word of advice for our listeners out there, because obviously this is Breast Cancer Awareness Month that we've got at the moment, October, and if you can talk to us about the early detection and importance of that, and how much of a role do healthcare providers have in reassurance and also getting the patients checked up. If you can comment on that to conclude the discussion.
So one of the things which, especially in Dubai, when you have young population, everybody is busy. But people don't get time to take care of their health, right? We people don't spend on health, people don't take care of their health. But it is the health which is very important than your wealth and anything else. So when it comes to screening, most of the science is advanced so much that if any disease of yours is detected early, especially breast cancers, can be cured 100%. But often what we end up detecting late. That means, especially when you have a family history of a disease, especially on cancer, I strongly suggest that they need to go in for screening and early detect, and then the treatments are available. And unlike yesteryears, it's comparatively cheaper. So our aim is to keep the entire population healthy, rather than getting them when they are sick. So the entire trend is moving from healthcare. Right now, what we don't practice healthcare, we practice sick care. When patient becomes sick, they come to the hospital. Now, the hospital and healthcare industry should move into real healthcare. When I mean real healthcare, we should be able to get people healthy. So it is very important that people go in for screening, especially when you have a family history.
Well, rightly put there. Well, thank you very much for joining us, Dr. Sherbaz, and we look forward to seeing you shortly, and also all the very best with the hospital in Sharjah as well.
Thank you. Thank you so very much.
Well, stay with us here on the Morning Majlis. We'll be back again right after some more musical entertainment as well as the business headlines. You're listening to the Morning Majlis only on Pulse 95.
If you liked this episode of the Morning Majlis, drop a like and subscribe.
95.
Be sure to follow us on Instagram for all our daily updates and top stories.
Pulse.